Chapter 56 Integumentary System Introduction. Just a little review for anatomy and physiology of the skin. We have the epidermis, the dermis, and the appendages. For epidermis, this is the outermost layer of the skin, and the base of the epidermis is the one that's actually continually producing new cells to replace those that is in the surface. Epidermal cells also produce melanin, right? The dark pigment that helps to determine the color of the skin. And then you have the dermis. The dermis is a strong connective tissue that contains the nerve endings, the sweat glands, and then the hair roots. The dermis is well supplied with blood vessels, causing the skin to redden when surface vessels are dilated. And then after the epidermis and then the dermis, then it's the subcutaneous tissue. The appendages are those hair, nails, and the sebaceous glands in the skin. Okay, what are the functions of the skin? Protection, temperature regulation, secretion, sensation, synthesis of vitamin D, and also a reservoir for blood. The skin performs its protective function by shielding underlying tissues from trauma and pathogens, and by preventing excess loss of fluids from those tissues. And then for temperature regulation, the skin alters the diameter of the surface blood vessels and through sweating. That's how we do the the skin temperature regulation. For secretion, we do like sweat, right? Sweat secretion. Sweat is one of the skin secretion, and then another is like those oil, those sebum is what we call it. The skin for the sensation is heavily endowed with those sensory receptors for like touch, for pressure, pain, and for temperature. For the synthesis of vitamin D, the ultraviolet, the UV rays in sunlight, what they do is they activate a substance in the skin that eventually is converted into vitamin D. The skin contains an extensive blood vessel network that can store as much as 10% of the body's total blood volume. Right, let's go to page 1105, figure 56.2. And let's go over this lesions, types of lesions, type of skin lesions, one by one. So macule, this is a flat area with color different from surrounding tissue. Examples are your freckles, your petechiae, your hypopigmentation, and then papule is any raised lesion with clearly defined margins. Example is the moles, right? Mole or warts. Vesicle is a raised fluid-filled cavity. Example are those blisters from your herpes simplex, herpes zoster. Pustule is actually a raised, well-defined cavity that contains pus. That's why it's called pustule. One sample is your acne or impetigo. And then patch is a macule. Example is vitiligo. For your plaque, combined papules that form a raised area. So one example is your psoriasis. Nodule is a raised solid lesion. It may be hard or soft and may extend deeper into the dermis than the papule. Sample is your fibromas. Wheal is a superficial irregular swelling that is caused by fluid accumulation. Most of the time we see wheals for like allergic responses and those insect bites. Tumor is a firm or soft lesion that extends deep into dermis, may be firm or soft. Sample is lipoma. Bulla is a thin-walled fluid-filled chamber. Sample of this is a blister. Crust is a thick, dried exudate remaining after the vesicles rupture. Example is the impetigo or the weeping eczematous dermatitis. Scale is a dry or greasy skin flakes. Sample is your psoriasis, right, or seborrheic dermatitis. Scale is fissure is distinct linear crack extending into the dermis. Sample is your tinea pedis. Erosion is a shallow superficial depression. Sample is your impetigo or your herpes. Ulcer is a depression deeper than erosion and it may bleed. Sample is pressure injury or what we call the chancre. Excoriation is an abrasion caused by scratching. Example is scratching with skin bites, insect bites, and scabies or dermatitis. Nevus is a mole, flat or raised, and cyst is a fluid-filled cavity in dermis or subcutaneous tissue. So sample is your sebaceous cyst. All right, when we do the assessment for the integumentary system, very important for us to know and assess the patient with what is actually norm, right, for them. So, for example, is that if you see one skin lesion and you ask them, is this something new, right, or has it been there all through your life, right? Is the border of the lesion actually clean, or is it like irregular? Okay, those things are the things that we need to assess when we're doing the integumentary system assessment. Right, what are age-related changes? There will be wrinkling as a result of thinning skin layers and degeneration of those elastin fibers. Their sweat glands will decrease, although production changes little until advanced age. The production of the sebum also decreased, becoming apparent earlier in women than in men. Dryness and pruritus are common. Skin pales become because the number of the cells that produce melanin decreases, and skin lesions are more common. The nails will be flat, become dry, brittle, and discolored. Diagnostic testing and procedures. So we can do culture and microscopic examination of skin specimens. Like for example, we are trying to rule out scabies, right? Or rashes from scabies. So what we do is we actually take a culture and then we send it to the lab so that they can take a look at it microscopically, and then they would be able to diagnose it. Wood's light examination is the use of a black light to assess for pigmentation changes and superficial skin infections. Patch testing for allergy. So what we do is we put those very small amount of the common irritants in the skin, and then we cover it, and then later what they do is they go back and examine it for like allergic reactions, but we call it patch testing. Okay, biopsy. If you go to page 1107, we can figure 56.5. These are types of biopsy procedures. So you have one is shave, when they kind of like just shave it, a specimen no deeper than the dermis. right? They use that scalpel to actually just scrape it. um, and then you have your punch biopsy, which is a circular tool that cuts around the lesion, and then they lift it up and then they severed it. The incisional biopsy is when there's a wedge of tissue that is removed from the lesion. And then you have excisional biopsy, which is what we do if it's like a deeper excision for biopsy. For excisional biopsy, the entire lesion is removed. So what we most of the time sutures is required to close the skin after the procedure. Therapeutic measures, so we can do dressings, negative pressure wound therapy, soaks and wet wraps, and phototherapy, and some drug therapy. So dry dressings, we can use dry dressings and wet dressings, absorbent dressings. So for dry dressings, we protect wounds and absorb the drainage. Wet dressings, we use it for, hold on, here. Dressings, we can actually use that to decrease inflammation, we soften the crust, and then we promote tissue granulation. Absorptive dressings are used to promote removal of excess exudate and are especially useful in wounds with necrotic tissue. Occlusive dressing also we use to protect wounds and maintain moisture to promote the healing. Negative pressure wound therapy are those actually your wound vacs, and what it does is it actually makes sure that those drainage that is coming from the skin or from the wound is actually being vacuumed and collected. And then soak and wet wraps, like your wet to dry therapy, right? Where we actually would wet the gauze, put it in the skin, in the wound, and then get a dry dressing and then put it over. Phototherapy may be used in the treatment of psoriasis, vitiligo, and even chronic eczema. What we do is for some phototherapy, they use like ultraviolet treatment in combination of oral or topical metal, like a chemical that they use in addition to the UV light. All right, and then drug therapy in page 1109. Let's go over the common ones. So, keratolytics, you have your benzoyl peroxide. This is also an antimicrobial, but please know the use and action. Used for to treat dandruff, acne, and psoriasis, and then for the side effects is excessive dryness, irritation, scaling, edema, and photosensitivity. Nursing intervention, we advise a patient to avoid excessive sun exposure. And then for all oral antibiotics, doxycycline, minocycline, tetracycline, and erythromycin, we can use this for acne. Side effects is sensitivity to UV light. So make sure that those patients actually taking these antibiotics when they go out, they're actually covered. Maybe long sleeve or a hat, right? Or sunblock, very important. Wear protective clothing or use sunscreen. Topical antibacterials like your bacitracin, silver sulfadiazine. Bacitracin is an antibacterial. This destroys microorganisms. Your silvadine is also bactericidal, but we usually use this to prevent and treat wound infections with serious burns. Okay, and then we can give them antivirals, interfere with viral replication, and then topical antifungals against fungi, and then topical anti-inflammatory agents, your hydrocortisone, triamcinolone, and this one reduces inflammation in various skin condition. What else? Yeah, and then just go over the table 56.4 from page 1109 to 1111. All right. Question 1. Which of the following is not a function of the skin? Answer is B, secretion of hormones.